Welcome to Youngstown, welcome to our family. Bienvenidos a Youngstown, bienvenidos a nuestra familia.
Makadiyenu tafarne kuzevai. How are you? We're glad to meet you.
به خانواده ما خوش اومدید. Welcome to our family.
Welcome to Youngstown Primary Care.
Welcome to Youngstown Primary Care.
Welcome to St. E's Youngstown.
Hello, and welcome to the St. Elizabeth Youngstown Family Medicine Residency. I am Dr. Jessica Handel, the Program Director, and I'm excited to have this opportunity to show you a little bit more about our program. We have had a continuous presence in this hospital since 1977, and we have an excellent reputation for training knowledgeable, skilled, compassionate physicians who are prepared to enter practice. Our residents train in a truly exceptional academic environment. Our hospital prioritizes medical education and has been a teaching hospital for decades. Our hospital is a level 1 trauma center, a stroke center, and has a neurosurgical intensive care unit, interventional cardiology, cardiothoracic surgery, and endoscopic surgery.
The most important factor for sure is something that I like to call the experience factor. Residency is the 3 years where you really have a chance to make it right, to really learn what you need to learn and be able to leave here and feel comfortable with practicing on your own. You will get those experiences here. Also, in the inpatient world, you will have a plethora of different diseases and things that you'll be exposed to. Everything you've learned in med school, you'll probably come across at least one time here.
I've been here for more than 23 years. 20 of those years I served as program director. I'm still here because I believe in what we're trying to do. During all that time, lots of things have changed, but one thing hasn't changed. Our goal here is to produce family doctors who can go out and be comfortable in any situation that they encounter. Another thing that I believe in is that medicine is exciting and interesting. Residency is a time to explore all the different possibilities available in family medicine, and you're doing it with a group of physicians who are there to guide you, as well as another group who are exploring family medicine for the first time as well. It should be fun. We try to keep it fun here at St. Elizabeth Mercy Youngstown Family Medicine.
So as a psychologist, my contribution to the program falls into two main areas. One is on education of how to incorporate behavioral health considerations to your patient care. The other part of my role is to oversee the wellness opportunities for our residents. So those include things like a monthly resident support group, a yearly resident retreat, as well as informal consultations on resident well-being. Mercy Health recognizes that in order to be the best physician that you can be, your own personal health and well-being is important to consider.
As a faculty member, we are committed to helping our residents develop professionally and to their best ability outside of medicine. One of the strengths of our residency program here in Youngstown is that we respond directly to our resident feedback. This allows us to grow and improve and continually be the best program for our residents. Another one of our strengths is the varied background that our faculty bring, from sports medicine training to geriatrics to obstetrics to community medicine, public health. Choosing to come here will afford you the opportunity to learn through all of these disciplines, including also HIV and hepatitis C management.
So we're very lucky in our program to have the opportunity to work with many different specialists who are more than willing to give us their time and efforts to help with training so that the residents are not only receiving training during their rotations, but also each Wednesday in our Family Medicine Center during our didactic sessions.
Our residents have appropriate oversight at the program, starting from the first day until their last day of training.
There is a strong sense of camaraderie amongst our residents. We help to establish that by bringing all of our residents back on Wednesdays each week to see each other during our didactic sessions, and then that also extends outward with all of the extracurricular activities that our residents tend to do together.
The program has an excellent reputation locally with decades of graduates practicing still within the area. The residents are sought out for recruitment opportunities early on in their training and are well placed within the community in the surrounding areas if that's where they choose to practice. However, some of our residents choose to go outwards within the United States and then outwards internationally as well, and they've succeeded in all the places they've gone.
Since I moved, everyone has offered to help me in one way or another, whether that was with trying to get housing arranged, even just day-to-day work, because the transition from being a student to being a PJ1 is a pretty steep learning curve, and I've needed everyone's help at one point. So I'd say that everyone's always willing to help.
In a lot of the other residency programs, with the attendings, there was always the scary one that you were nervous to talk to, and this program didn't have one of those. Every single attending I talked to was more than willing to help and great at teaching, and I appreciated that.
Nobody ever makes you feel like you're less than, and we all have the atmosphere where we can ask questions freely.
I think the patient population is one that you can learn a lot from, just because sometimes you don't know what's going to walk in through the door, and you need to be able to manage that. So I think in the future, I definitely feel like training here, I'll be prepared for a lot of different circumstances just based off the patients that I've been able to see while I'm here.
It's kind of my dream job, honestly. I mean, I wanted to be a doctor since I was a kid, and with this program, I've learned how to do that, the ins and outs. There are things that were not as hard as I thought they'd be, and there were things that were much, much harder than I thought they'd be, but they saw me through all of it, and now I'm doing what I've wanted to do for the last 16 years.
Seeing myself from a student to now almost an attending, I've seen so much growth, and it's nice to see the light at the end of the tunnel and that all my hard work has paid off.
So I'll say for me, I was fortunate enough to be able to rotate here as a medical student, spend some time with the program. And for me, it ultimately came down to work-life balance. The residency is very doable, but you work really hard, and by the time you're done, you're fully prepared. And so for me, it was that work-life balance where it's a combination of, you can enjoy your time during residency, but at the same time, you'll be really prepared by the time you graduate.
I think it's a very family-friendly program. I came with a child. I had 2 children during residency. I think that the program is wonderful. The faculty is accommodating, and like Dr. Kaiko said, I think it prepared me very well for life outside of residency, because Youngstown has a lot of pathology. You'll see a lot of different strange things here that you might not see other places, and like I said, I think it prepares you really well.
Well, hello everyone. My name is Kathleen Harley. I'm the president here at St. Elizabeth Youngstown, and today I'm going to be with you as we go through more of your virtual journey, specifically looking at the residency living quarters. What I am so interested and happy to let you know is we have now a revamped 18-room residency quarters. Within those quarters, you will find a great dining room, common area, computer lab, and just an overall comfortable place to be. We have focused on this because we know how important your clinical competency is, but we also know you have downtime that's needed, and we want that downtime to be able to be productive. This is our commitment as administrators to our GME program. We are so thankful for the great program that our faculty and our associates have put forth, and this is our way to give back to that same commitment they're committed to every day, to give you a great experience.
Our graduates have pursued such diverse areas as inpatient hospitalist practices, outpatient, traditional family medicine, urgent care, academic, international missions, rural and urban practices. A few of our residents have chosen to pursue fellowship, and our residents have been 100% successful into matching into their chosen fellowship specialty on the first attempt in such programs as sports medicine, hospice and palliative care, and sleep medicine. We are so very proud of our current residents, who are a diverse, energetic, and brilliant group. We hope to continue to foster diversity in our program. Family medicine is a diverse specialty, and to best serve our patients, we hope to carry that diversity through our program. Thank you for taking the time to learn more about our residency. I look forward to meeting you soon.